Landau-Kleffner syndrome, a public service announcement by Lauren and Amy. What is Landau-Kleffner syndrome? It is a rare neurological condition, also known as acquired epileptic aphasia or aphasia with a convulsive disorder. It occurs in previously typically developing children between the ages of 3 to 7 years old, and it is twice as common in males as it is females.
Symptoms vary on a case-to-case basis and in severity, but some typical symptoms include progressive or sudden decreased language abilities, specifically difficulty in understanding spoken language, which is known as auditory verbal agnosia. The majority of children will have severely abnormal EEGs and seizures while sleeping, approximately 70%. However, this is not the case in all of the cases. These seizures interfere with memory and development that occur in the part of the brain that deal with language, which leads to the difficulty in understanding spoken language, but it can also impact the child's ability in language expression, which is known as aphasia. The child can also have a decreased understanding of environmental sounds, such as deciphering between the sound of a bird and the sound of a car horn. Typically has normal hearing and intelligence and may sometimes display behavioral changes, such as hyperactivity, withdrawal, and changes in temper, and attention problems.
The cause of Landau-Kleffner syndrome is largely unknown. However, a relationship has been found between a spectrum of epileptic conditions and Landau-Kleffner. Another possible cause is gene mutations, specifically one that deals with glutamate metabolism GRIN2A, causing decreased protein that sends signals to neurons and interferes with the communication system in the brain. In genetic cases, it is inherited in an autosomal dominant pattern, meaning only one copy of the GRIN2A gene needs to be affected for the person to display symptoms. Due to patients' responses to immunosuppressants, researchers also suggest an autoimmune disorder causal factor. Interestingly, links are only rarely found between siblings and twins.
Who are the team members? The team will consist of members from various disciplines and will include the child, family members, pediatrician, neurologist, neuropsychologist, speech-language pathologist, audiologist, psychologist, and special education teachers. All of these team members will work together to diagnose and to provide the best treatment for your child. What does the diagnosis involve? In order to diagnose Landau-Kleffner syndrome, a regression in language skills must be accompanied by the presence of severely epileptic form activity on an EEG, specifically during non-REM sleep. The first test to do so will be an EEG, which shows the brain waves using electrodes attached to the child's head. It will show spikes, especially during sleep, which are abnormal EEG findings and present clinical seizure. An MRI may be completed to rule out structural deficits or other conditions, and an MRI typically shows normal results. Other tests include genetic testing, an audiological exam to rule out hearing loss, and a speech and language evaluation to assess the current language abilities.
What does treatment for Landau-Kleffner syndrome include? Anti-epileptic drugs are often the first step in treatment, specifically corticosteroids and pulse benzodiazepines. If the medication doesn't work, doctors may suggest a ketogenic diet, a 4-to-1 fat to non-fat ratio, or treatment with intravenous immunoglobulin may be recommended. Multiple subpial transection surgery is another option. However, it is still regarded as experimental. It is a procedure that cuts the pathways with abnormal brain activity. And of course, speech therapy is recommended to facilitate language development. What does speech therapy include for children with Landau-Kleffner syndrome? Speech-language therapy will often involve helping individuals understand and use spoken language. Additionally, because children with Landau-Kleffner syndrome often present with symptoms of hearing loss or auditory processing disorder, treatment may include strategies used for children with difficulty hearing, including FM systems, cued speech, preferential seating, and auditory training. Augmentative and alternative communication, or AAC, methods have also been highly successful with children with Landau-Kleffner. Sign language has been one of the most effective forms of AAC. High-tech devices like iPads with communication apps are also used, and the picture exchange system and other visual communication systems, such as visual schedules, might be used. All of these AAC methods teach language concepts and do not prevent verbal language recovery.
What is the prognosis? So, the overall prognosis is impacted by the age of onset. Specifically, there is a better prognosis for children with a later age of onset, specifically after 6 years of age. In regards to their seizures, they generally stop by adulthood and begin to decrease around 10 years old. With respect to their language skills are unlikely to return to normal expectations. 8 out of 10 children are left with severe language difficulties. However, 10 out of 20 children have normal language and learning in adulthood. Many children regain their language skills with speech therapy, so there is a better prognosis the earlier that speech therapy is started.
For more information and support for families and caregivers, please check out some of the links we have listed here for the Epilepsy Foundation, American Speech Language Hearing Association, Friends of Landau Kleffner Syndrome, and the Genetic and Rare Diseases Information Center.
Please refer to this list of references, which were used as the basis for the information that was discussed in this PowerPoint, for further information. Thank you.